on understanding total worker health, where we've been and where we're going. My name is Jeannie Nigham, and it's my pleasure to serve as the moderator for today's webinar. On behalf of the Niosh Total Worker Health Program, we are delighted to have you with us today. First, we'll hear from Dr. Sara Tamers. Dr. Tamers is a health research scientist and the team lead of the Research Program Development and Collaboration in the Office for Total Worker Health at the National Institute for Occupational Safety and Health in the Centers for Disease Control and Prevention. Sara is also the Assistant Coordinator for the CDC Niosh Healthy Work Design and Wellbeing Program. In these roles, she oversees and coordinates activities related to the intramural and extramural total worker health research base. Her research addresses total worker health, occupational safety and health, worker well-being, the future of work, life course perspectives, obesogenic behaviors, social determinants of health, social networks and support, and cross-country comparisons. Our second featured presenter today is Captain Mary O'Connor. Captain O'Connor manages the Aviation Safety Research Project at the Niosh Western States Division in Anchorage, Alaska, and is a commissioned officer with the U.S. Public Health Service. Mary has been with Niosh since 2009. Prior to that, she managed environmental health services for an Alaska Native health organization and traveled to Native communities throughout Alaska. She has also worked as an environmental health specialist in Wisconsin and Michigan and has been deployed in disaster response operations nationally and internationally. She received a Bachelor of Science degree from Michigan State University and worked as a registered medical technologist before receiving a Master of Science degree in Environmental and Public Health from the University of Wisconsin-Eau Claire. Mary has been a pilot for over 25 years. She holds a fixed-wing commercial pilot's license and is a certified flight instructor. Finally, we'll hear from Chia-Chia Chang. Chia-Chia is the coordinator for partnership and new opportunity development for the Office for Total Worker Health at the National Institute for Occupational Safety and Health, Niosh, in the Centers for Disease Control and Prevention. Besides leading the Niosh Total Worker Health Affiliate Program, Chia-Chia coordinates a task with RAND to develop a framework and assessment tool for worker well-being and collaborates with stakeholders to share research and promising practices related to advancing total worker health. So just to cover a few housekeeping issues before we get started with the content for our webinar today. Your audio will come from your computer, speakers, or earphones. Please assure that your volume is turned up to a comfortable level so that you can hear the presenters. For any further technical support, contact Adobe Connect meeting support using the telephone number listed here, 800-422-3623. Live captions are available for this meeting for anyone who would like to follow along. Captions can be viewed in real time in the Adobe Connect screen, which should be at the bottom of your screen, bottom left of your screen, or open in a separate web browser window via the link provided in the Notes for Attendees box. So this slide here shows what you should be seeing on your computer monitor for the webinar. Notes for attendees should be in your upper right-hand side, which has the captions link, as I just mentioned, and the Q&A box, the file download. So it should all look like what you see here on the screen. Anyone wishing to supplement their viewing experience may email twh@cdc.gov to request the unedited transcript of today's webinar. During the webinar, you can submit comments, questions, and problems to the Q&A box at the bottom of your screen. All presenters and meeting hosts will be able to see what you submit into the box and can respond accordingly. You may submit questions throughout the presentation. However, content-related questions will be addressed only at the end of the webinar during the Q&A session. If you would like to download any of the files shared during our presentation today, you may do so just by clicking just below the Q&A box. You'll see the slide deck available for download there at the bottom right-hand side of your screen. Continuing education. Free continuing education credits are available for this presentation through the CDC's Training and Continuing Education online system. Detailed instructions on accessing the Training and Continuing Education office site are available for download. Note that the orange activity number noted here for the live activity number is only valid for those watching the live webinar. You will need the course access code to receive credit. The blue activity number listed here is to be used only by those who view the archived webinar. This webinar will be recorded and posted in the near future for those who couldn't join us today. So at this point, I'm going to turn it over to Dr. Sara Tamers, who will be talking about the total worker health approach from 2014 to 2018 and beyond. Thank you, Sara.
Thank you, Jeannie, and good afternoon, everyone. So for my portion of this webinar, we'll begin with an overview of the total worker health approach. Next, we'll focus on total worker health highlights from 2014 to 2018. And then we'll conclude with some current activities and next steps. So whether you're new to total worker health, welcome, or whether you're one of our more seasoned stakeholders, this and our two subsequent presentations should provide you with new, updated, and or refresher material all in one condensed webinar about where the total worker health approach has been and where it is going, as the webinar is aptly titled. All right, so let's begin now with an overview of the total worker health approach. The total worker health is all about workforce safety, health, and well-being. Specifically, total worker health is focused on how the workplace and work contribute and therefore can be modified to improve workforce safety, health, and well-being issues and outcomes. Now, in tandem, we're also very much focused on the inextricable relationship that exists between many different workforce safety, health, and well-being issues, not just on, but also off the job. And I like this very simple pie chart depiction here from one of our centers of excellence for total worker health, which you'll hear about in just a moment, demonstrating examples of different safety and health issues that clearly straddle both work and non-work or home spheres. After all, while we may only wear our worker hats during a portion of a 24-hour period, as we know, we can live with these health and or safety-related issues 24 hours a day. Now let's define total worker health. Total worker health is defined as policies, programs, and practices that integrate, that's a key word there, protection from work-related safety and health hazards with the promotion of injury and illness prevention efforts, and all of this to advance worker well-being. Let's break it down a little bit more simply now. Total worker health is about, first and foremost, keeping workers safe. We then simultaneously, comprehensively integrate the three workplace P's that grow health, and in doing so, we create worker well-being. For those of you who are new to total worker health, let's take a quick look at a few simple examples of what the total worker health approach could look like in practice. Now, one example could be the provision of mandated respiratory protection programs that simultaneously and comprehensively address and provide support for tobacco cessation. A second example could be hearing conservation programs that provide motor enclosures built from barrier-type materials for pumps and that simultaneously and comprehensively offer strategies to limit other risks to hearing. And finally, a third example could be musculoskeletal programs that reorganize work while, you got it, simultaneously and comprehensively providing both ergonomic consultations and arthritis self-management strategies. Some traditional occupational safety and health and or worksite wellness programs, that is non-integrated, standalone, siloed approaches, have had a favorable impact. However, we know increasingly that for tackling the wide-ranging, complex concerns of workers, integrating these OSH protection activities with health-enhancing ones may in fact be more efficacious than simply concentrating on either of these activities alone. And so to that end, studies have shown that emphasizing a total worker health or integrated approach to jointly and comprehensively focus on work-related hazards and other exposures addresses those synergistic risks that exist and engenders then more promising efforts and results, such as those highlighted here on the screen. So the promise of total worker health is vast, and it can extend not only to the worker and employer, but also beyond to family, community, and society. If you're new to total worker health, or if you've been away for a bit, I encourage you to read the many peer-reviewed articles on total worker health that have emanated from our key partners and stakeholders, both within the walls of Niosh and beyond. And I've included a link there that will take you to an inventory that we have. One of the questions we sometimes receive is, how does the total worker health approach align with Niosh's mission? Well, quite nicely. Niosh's mission is simply and importantly to keep workers safe. Total worker health builds upon that by broadening those very worker safety and health efforts to include other factors influencing health risks on and off the job. The total worker health approach is also designed holistically and comprehensively and offers such opportunities in the areas of higher quality work, safer work, and very much so better designed work. Now, as we all know, safety and health issues are rarely simplistic. While total worker health, again, by its very design, includes looking at the complex, multifaceted, or layered systems and approaches at play with worker well-being and facets of the work environment and so on. And finally, in total worker health, we also partition our efforts into 4 overlapping categories of research and tangible solutions resultant, as well as in practice, policy, and capacity here meaning workforce development. Now let's take a look at some of the principal players in total worker health. Beginning with the Office for Total Worker Health Research Support and Coordination, as it's more formally known, and Office for Total Worker Health for short, which leads Niosh Total Worker Health activities. The office was established in early 2014 and is led by Dr. Casey Chosewood. We have 5 program arms, as you see listed here, each coordinated by different team leads and each with vast and distinct yet overlapping portfolios of work that extend within and beyond Niosh, aimed at coordinating and supporting total worker health efforts, both intramurally and extramurally. In addition to our 5 program arms, we also have a few additional team members as well that are all integral to our efforts. Within Niosh as well, key total worker health partners include members of our Total Worker Health Collaboration Council, the Healthy Work Design and Wellbeing Program, which we'll touch on later on, as well as the National Center for Productive Aging and Work, otherwise known as NCPAW. And if you don't know of NCPAW's work yet, I encourage you to visit their website, which is listed here. In addition to Niosh Total Worker Health research activity, the bulk of total worker health research and other related efforts is conducted by 6 Niosh-funded extramural centers of excellence for total worker health. Now, these centers are uniquely qualified to be among the leaders in the field of total worker health and are truly crucial to gaining knowledge that can help workers, employers, as well as communities. Total worker health activities are also shaped by our 46 Niosh Total Worker Health affiliates listed here as well on the right, which is a partnership program developed in 2014 to recognize not-for-profit, labor, academic, and government organizations that are advancing the total worker health approach. Now, though the Niosh Total Worker Health affiliates do not receive funding from Niosh, they are also critical to all of the activities discussed, each in their own unique way. And you have a web link here, again, to provide you with more information about both the centers and affiliates. All right, now let's take a look back at where total worker health has been, beginning with 2014. A vital and key event, really in the maturation of the total worker health field, was the convening of a total worker health scientific conference. Now, building on prior initiatives and symposia, the Office for Total Worker Health held the first international symposium to advance total worker health at the National Institutes of Health. Now, the symposium brought together over 17 partner organizations and more than 350 national and international scientists and practitioners. Now, let me just give you a sense of the breadth of total worker health stakeholders. Participants represented academia, labor, industry, and government in the areas of workplace health, human resources, employee benefits, employee assistance, health promotion, organized labor, workers' compensation, disability management, emergency response, public health, health policy, health economics, organizational and occupational health psychology, industrial hygiene, and even more related disciplines. So again, you can see the vast and varied reach here of stakeholders relevant to total worker health. Now, for those of you who missed the symposium, we explored topics relevant, of course, to a total worker health perspective, such as frameworks, research methods, integrated approaches, implementation, as well as evaluation and practical toolkits. Sessions highlighted high-risk industries, such as construction, transportation, and healthcare, specifically in the areas of work stress and psychosocial factors, as well as obesity and musculoskeletal conditions. They also emphasized examples of integrated interventions for a changing workforce, new employment patterns, physical and built environment, community workplace support, advances in return to work policies, as well as disability and rehabilitation management. And if you were unable to attend the symposium, or if you'd simply like a refresher, select presentations and other relevant information are still available at the web link listed there on your slide. So that same year, in fact, during the first International Symposium, a plenary session consisting of research and training experts from our centers, affiliates, and ERCs covered current training initiatives, plans to formally solicit external input and engage key stakeholders, curricular reform, and integration of total worker health into Niosh-funded ERCs. Now, during this session, speakers and participants confirmed a growing need to increase the knowledge and skills of researchers and practitioners to implement an integrated total worker health approach through interdisciplinary education of both the existing and future workforce. The Niosh Workforce Development Framework Guidance, which is an unpublished Niosh-led document shared with select stakeholders and partners, explores approaches to build capacity and identifies competencies and training that professionals need to apply an integrated approach that addresses the diverse needs of the U.S. workforce. The guidance includes 5 broad foci necessary for professionals to apply a more comprehensive total worker health approach, as well as recommendations for accomplishing this goal as you see listed here. And work in this area by the Office for Total Worker Health and many partners continues to develop, and we'll touch on this again in a little bit. All right, moving along to 2015. A significant accomplishment in the development of new partners in recent years was the Office for Total Worker Health co-sponsorship with the NIH Office of Disease Prevention and the National Heart, Lung, and Blood Institute to convene the 2015 NIH Pathways to Prevention workshop entitled Total Worker Health, What's Work Got to Do with It? One of the reasons that this was a significant accomplishment is that approval for the conference's Total Worker Health theme was actually a big deal. It required buy-in from several other NIH offices and institutes and U.S. federal agencies, making this a pretty noteworthy total worker health partnership achievement in really raising awareness of the importance of total worker health issues across U.S. federal agencies. The workshop had over 700 registered attendees, making it actually the largest total worker health event to date, although we'll certainly try to beat that. There were several outcomes, including a review of the literature on research gaps and an independent panel report on future research priorities if you'd like to learn more. Now here you see the 8 recommendations put forth by the workshop's independent panel, several of which we began tackling, as you'll hear later on. Another objective of the Office for Total Worker Health was to update a summarized list of seminal and current issues relevant to total worker health and to the future of the workforce to advance the scientific research focus and direction. And indeed, this is a graphic here that depicts what the Niosh Office for Total Worker Health believed in 2015 to be the most salient and priority areas for total worker health. Now, aside from the more customary workplace hazards that organizations have long faced, importantly such as chemical exposures, traumatic injury, and shift work, workers and employers, as we all know, have also been navigating other safety, health, and well-being issues reflected here. So, for example, changing workforce demographics, growing work-life balance challenges, a multi-generational and aging workforce, rising levels of work-related stress, and new work arrangements, just to name a few. Now, this graphic really boils down, quite simply, those priority total worker health areas, so do take note of that web link. On to 2016. Published in 2016 by the Office for Total Worker Health, the hierarchy of controls applied to Niosh Total Worker Health expands the traditional hierarchy from occupational safety and health, of which I'm certain all of you are aware, to include controls and strategies that more broadly advance worker well-being. Now, make no mistake, our hierarchy is not meant to replace the traditional hierarchy of controls, but rather is a companion to this important OSH model. It serves to illustrate how total worker health approaches emphasize organizational level interventions to protect worker safety, health, and well-being. And we've actually found this to be quite a practical, tangible aid to many of our stakeholders. If you go to that provided web link, we also briefly walk you through how to apply it. Speaking of practical, tangible aids, let's now turn to the Fundamentals of Total Worker Health Approaches published that same year. Now, this workbook, with its 5 fundamentals listed here, will help you develop new total worker health initiatives or better align existing workplace interventions with the total worker health approach. Now, because each workplace is unique and the experiences of the people who manage and work in them differ widely, this is not intended as a one-size-fits-all tool for program development. However, this workbook can be used to, 1, provide a baseline snapshot of where your organization is on the path to total worker health. 2, identify initial steps to improve workforce safety, health, and well-being in line with the total worker health approach. And 3, help you to measure your organization's progress along the way, that evaluation piece that is all so important. And you can also download this for free via the provided web link right there. Moving on now to the National Total Worker Health Agenda. This agenda includes a set of strategic, intermediate, as well as activity output goals for the nation to move the field of total worker health forward over a 10-year period, as you see listed from 2016 to 2026. Now, if you recall from one of the earlier slides, total worker health partitions its focus in 4 distinct but overlapping categories of research, practice, policy, and capacity building. And this is indeed how we divided our agenda. So if you're interested in learning about total worker health needs, gaps, and how the field needs to evolve, you can also download a free copy. Now, I'm pleased to say that in only 3 years since its publication, we've already made headway. However, just as the case with anything else, much more work is needed, and all stakeholders are really, truly, heartily encouraged to become involved. The Total Worker Health Program has had an impact on other Niosh programs through the recognition of well-being as an imperative component of the Niosh intramural research program structure. This included enhancing future collaborations and deepening connections in the area of improved work design and well-being across Niosh. To that end, in 2016, 3 separate and independent programs, Total Worker Health, Economics, and Work Organization and Stress-Related Disorders, became the Healthy Work Design and Wellbeing Program, otherwise known as HWD. Now, like the Total Worker Health approach, the HWD program views workplaces as settings not only to impact work-related risks, such as unsafe working conditions, high job demands, and low control, but also to promote workplace programs and conditions that provide support for workers' health and well-being. And again, I've included a web link here, as there really is a lot more information about the HWD program available to you. In 2017 and prior, we began quite a few efforts that took shape in subsequent years. So in 2017, I'd actually like to just focus on one important total worker health endeavor. Stemming from some earlier efforts, namely at the first International Symposium, as touched on a little bit ago, in 2017, the Office for Total Worker Health, along with UNC and Harvard, convened an important workforce development roundtable. And you can see key internal, external stakeholders and partners involved listed here. The goals of this roundtable were to identify highest priority audiences, perform needs assessments, identify competencies for total worker health, and suggest effective training approaches and programs. Now, of note, currently several differing types of continuing education and certificate programs are in development, with some already available. These programs include total worker health approaches in already existent OSH or health promotion programs, or the creation of new ones altogether in different schools, such as schools of business, engineering, nursing, occupational medicine, residency programs, and others. Now, post-roundtable work continues, and a white paper of findings from it, including recommendations, is well underway, so stay tuned for that. Now let's turn to some of our more recent efforts just last year. Beginning with the second International Symposium to Advance Total Worker Health. Now building off the first symposium, also at NIH. The second included more than 100 partners and affiliate organizations and nearly 400 participants from 37 U.S. states and 15 countries. Again, for those of you who missed it, our participants and presenters came from just as wide and diverse disciplines, and topics covered integrated total worker health methods, approaches, interventions, evaluations, results and recommendations, in specifically and above high-risk industries and occupations such as transportation, agriculture, as well as firefighting and first response, manufacturing, healthcare, and law enforcement and corrections. Risks, exposures, and health conditions facing many workers in these fields, such as acute and chronic diseases, stress and mental health, as well as fatigue and violence, were tackled. Needs of small businesses, special populations, and government workers, strategies for optimizing community collaboration, organizational policies and practices, supervision, employee relations practices, and ways to enhance the work-life continuum and work design were highlighted. And we also had work around worker health and well-being through the lens of new technologies, the current opioid crisis, globalization, and the ever so rapidly evolving domestic and international economy. So we've talked about worker well-being, but what more concretely have we done in this area? Well, the Niosh Office for Total Worker Health partnered with the RAND Corporation to develop a framework for worker well-being. Using multidisciplinary literature reviews and an expert panel, a worker well-being model with 5 major domains, as you see illustrated here, was created. Now, the framework conceptualizes worker well-being as a subjective and objective phenomenon that is inclusive of experiences both within and beyond the work context. This effort also laid the foundation for subsequent well-being measurement activities and will provide useful tools, such as a worker well-being survey instrument, which is actually under development, that will then lend itself, hopefully, to helping better measure and advance worker well-being. And again, I've included that web link there for the peer-reviewed article on the development of the worker well-being framework. Last but not least, in 2018, we published the Research Methodologies for Total Worker Health paper, which included proceedings from the similarly titled workshop, planning for which began in 2016, with the workshop being held in 2017 at one of our Centers of Excellence for Total Worker Health. The motivations for this workshop were several-fold, including recommendations from the 2015 NIH Pathways to Prevention workshop, as we touched on earlier, as well as goals from the National Total Worker Health Agenda, also noted previously. The overall objective of the workshop and its subsequent paper, as you can see here, was to highlight total worker health methodological and measurement approaches in use and suggest others with potential to advance the field, focusing specifically on the total worker health intervention research sphere. And if you're interested in learning more about research methodologies and measurements in this area, you can download the open access article. There's been a lot of headway in the field of total worker health over the past several years, and the Total Worker Health Program has continued to develop. Integration efforts have expanded to consider the synergistic opportunities between and among the health of workers at and away from work, and a broader look at the interplay of work and non-work factors and influences on the well-being of workers. Now here's just a short little snapshot looking at some of that. One of the first things we did in 2019 was to publish an article discussing in much more detail than we have today the evolution of the total worker health approach over the last several years. If you'd like to learn more about that evolution and next steps, this is also available to you, open access. Recall the issues relevant to advancing worker well-being through total worker health graphic that we had updated and published in 2015? Well, we're tackling it anew with a third revision that should be completed later this year. Now again, this updated graphic will depict what the Office for Total Worker Health believes to be the most salient and priority areas for total worker health. So do take note of its eventual publication online. So as I hope you've gotten a sense of, if you weren't already aware of this yet, the total worker health approach has applicability for all worker safety, health, and well-being issues across all occupations and industries, and Niosh recognizes this. And so the Total Worker Health Program has been tapped to lead Niosh-wide efforts related to emerging issues, with the opioid epidemic facing working populations being one of them. This is an effort that is being coordinated by our office's director, Dr. Casey Chosewood, and you have the web link to the opioids page here. Another emerging area over the last few years where Total Worker Health is now spearheading efforts is around the future of work. While future work-related activities have been ongoing in certain parts of Niosh already, this new initiative is a firm, clear dedication of support and investment Niosh-wide for all that is future of work. This is an effort that I am coordinating, so if you'd like to learn more, please feel free to reach out. We've also been working on a future work webpage that should go live soon, so stay tuned for that. Next, importantly and forthcoming, is an edited volume on total worker health. This book will serve as guidance for professionals on the foundations of total worker health, bringing together research and practice in comprehensive, integrated prevention strategies from both researchers and practitioners in the field. And you can see all the information you need to learn more on this slide. We've looked at 2019, but what's beyond even that? Well, a lot. Too much really to focus upon today. But I did want to be sure to alert you to a few down-the-road activities in total worker health that are already underway, beginning with the third International Symposium. Additionally, planning is already underway for a Total Worker Health Professional Society, which is very exciting. And lastly, we are also exploring the possibility of a Total Worker Health Journal. Now, not much more to share at this point on any of these three activities, but I did want to let you know that work around these is being done, and when we do have more to offer on these, we'll certainly do so via our website, newsletter, social media, and email listservs. As we conclude this portion of the webinar, I'd like to leave you with some key areas for future total worker health research, because continuing to build up the evidence base is vital. Now, what are some of the important new and not so new research gaps that need to be filled? Well, namely, continuing research, exploring the conditions of work impacting health and well-being outcomes of workers, both on and off the job. Targeted interventions, specifically for our highest risk and most vulnerable working populations across applicable occupations and industries. Healthier job design and work organization principles to advance worker well-being. Prevention, or at the very least mitigation of harms arising from hazardous work schedules. Unhealthy supervision, very important to total worker health, and psychosocial stress, which we know to be on the rise. Value of investment for total worker health approaches. This is certainly a prime one as we continue to make the case for total worker health. Optimization of well-being for families and society through employment. Again, knowing full well the trickle effect that worker safety, health, and well-being have beyond the workplace and workers. And finally, the safety and health consequences of the future of work. And a lot falls under the future of work rubric, so many research opportunities and possibilities there. And with that, I thank you for your time and attention, and now turn it over to Mary for the second presentation of today's webinar. Mary?
Thank you, Sarah. I'll be talking to you about total worker health research into practice and the integration of total worker health concepts into research. As Ginny mentioned, I'm not located in the Office of Total Worker Health, but I'm a researcher in Alaska in the Western States Division of Niosh, where I manage the Aviation Safety Project. We strongly believe in the importance of integrating occupational safety and health protection with workplace policies, programs, and practices to prevent injury and illness of workers. I'll be talking about total worker health in the context of aviation safety research, and I'll share some background why the work environment in Alaska presents unique challenges to addressing total worker health. I'll use some examples from a previous research project and then a current research project
to illustrate how we approach and integrate total worker health concepts in our research. And I'll also discuss our total worker health goals when we develop research projects and the interventions. Aviation is a critical means of transportation in Alaska. More than 80% of the communities here are not connected by roads. Airplanes are used similarly to cars, buses, and ambulances in the lower 48. For example, if a high school basketball team in rural Alaska wants to play another team, the team might fly to another village. Or if a nurse or a doctor wants to hold a well baby clinic in a village, they often need to fly from the hospital in a hub community to a village clinic to do so. There are 761 landing areas that are registered with the Federal Aviation Administration in Alaska, and that doesn't include the thousands of lakes, gravel bars, ice fields, glaciers, and tundra that are used as well. In addition to being a critical means of transportation in Alaska, the aviation industry generates considerable revenue, more than $3.5 billion per year. A substantial part of the workforce is employed in the industry. Aviation provides more than 47,000 jobs and accounts for 10% of the jobs in Alaska. Alaska is a large and geographically diverse area. We use a hub system of transportation from larger communities to smaller communities. There are over 300 commercial operators that fly passengers, cargo, and mail to more than 250 communities. Alaska is unique in that they have a special agreement with the post office that allows items to be sent by U.S. mail, but they bypass the U.S. Post Office. Hence, it's called bypass mail. It allows people who live in rural areas to afford to mail items that would normally be cost prohibitive to mail. Alaska has some unique challenges to advancing health, safety, and well-being, not only for workers, but for much of the population. Alaska has long hours of daylight in the summer and darkness in the winter that can make it difficult to sleep or to stay awake. People often resort to taping aluminum foil to their windows as a means to block out the sunlight in the summer, and they use lights to combat seasonal affective disorder symptoms in the winter. Extreme temperatures can make work challenging, especially when workers are outdoors or go in and out of extreme temperatures. Microclimates are local atmospheric zones where the climate differs from the surrounding area. This can cause differences in temperatures, dew points and visibilities, and cloud bases, adding an element of unknown conditions in the flight paths and adding stress to the flight planning process and also to the flight itself. Access and availability and even affordability of essentials can be a challenge for everyone. The cost of transportation is reflected in prices, whether fuel or goods are barged, driven, or flown into a community. Even with bypass mail, perishable goods like fresh produce can be very expensive when they are available. Access to exercise areas may be weather dependent and equipment options may be limited. Workers in the aviation industry in Alaska also face challenges to health, safety, and well-being. Seasonal work may put pressure on employers to make as much money as possible during the busy season. This may lead to pressuring employees to work longer hours or to pressure pilots to take flights in weather conditions that they might not be comfortable with. Long periods away from home may make it difficult for workers to get adequate, restful sleep. And pilots and maintenance technicians can spend long periods of time away from home. They may live in shared housing or man camps, which may subject workers to an atmosphere that's not necessarily conducive to good rest or healthy lifestyles. Short flights result in many more takeoffs and landings, which are typically the most hazardous part of a flight. Pilots often load and unload their own cargo, exposing them to the elements. These are just some of the examples of the ways in which commercial aviation in Alaska may be different from aviation in the lower 48. In 2010, the Federal Aviation Administration created a new proposal to limit fatigue for pilots flying large passenger aircraft. Niosh conducted focus group discussions with pilots and managers throughout Alaska to determine if fatigue was an issue for pilots. We found that there were some circumstances where there was a greater potential for fatigue, but we consistently heard a message from pilots and management that there was a need for education on fatigue awareness, prevention, and mitigation. This need was supported by the National Transportation Safety Board recommendation for all commercial aircraft operators to be required to provide fatigue-related information into initial training for pilots who are new to a company and in the annual training programs that are required for pilots every year. The recommendation notes that this training should address the detrimental effects of fatigue and include strategies for avoiding fatigue and countering its effects. We were able to develop a training program with a core curriculum based on extensive research that was previously conducted by Niosh. Shift work and long work hours, healthy living away from home, and fatigue prevention for nurses and truck drivers, among others, were topics that had been addressed in different publications and specific training programs. During our focus group discussions, we were told that anything that we did had to be real Alaska. Generic settings and recommendations wouldn't be credible for our audience. So we worked with our partners and stakeholders in the aviation industry to create and film scenarios using real pilots and aviation company employees in actual working locations. In collaboration with the Niosh Total Worker Health Team and the Education and Information Division, a training program was developed to educate pilots on fatigue awareness, prevention, and mitigation. The format consists of slides that are advanced manually with videos that reinforce information. There are accident reviews from the National Transportation Safety Board investigations, links to additional resources, quizzes, and a self-test where viewers can test their own sleepiness levels. The training is focused on aviation and pilots, but it includes research findings and facts that apply to everyone and resources that can be accessed by anyone. The training can be downloaded from our website. After peer review by aviation company management and external subject matter experts, we took the training to 3 classes of pilots that were undergoing annual or initial training. We were interested in hearing their comments about content, but we also wanted to make sure that the presentation was presented in an industry-appropriate manner. In our post-training surveys, 85% of the pilots thought that they could use information in the training to improve the quality of their lives. While we did approach the training from a holistic standpoint, we know that enhancing the quality of sleep, mitigating fatigue, and improving the quality of life is something that affects workers both on and off the job. Our current project involves non-fatal injuries among aviation workers in Alaska. Workers in Alaska experience the 5th highest rate of non-fatal injuries and illnesses in the United States. The rates for non-fatal work-related injuries and illnesses are higher for Alaskans than the rest of U.S. workers in 12 out of 13 reported industry sectors. There are substantial health burdens, medical costs, and costs of work lost with these injuries and illnesses. During 2000 to 2013, over $3 billion were paid in workers' compensation benefits in Alaska. A preliminary analysis of workers' compensation claims data indicates approximately one-third of the aviation-related claims came from ramp, baggage, or cargo agents. About 14% of the claims were from mechanics and maintenance workers, and 12% were from customer service agents and administrative flight support personnel. Claims by pilots accounted for less than 10%. Our current project incorporates total worker health principles in an update of a survey that was originally conducted in 2001 and 2002. The original survey included information only from pilots and managers, but since other workers and pilots, or other workers besides pilots, experience injuries and illnesses in greater numbers, the information about their events can provide a broader picture of aviation worker injury and illness on the job. The updated surveys will include pilots and managers, but also mechanics and maintenance personnel, ramp, baggage, cargo, and dock agents, customer service agents, and other flight support personnel. Survey questions will include information to help us gain a better understanding of the physical work environment and how injuries occur. We will ask about the types of tasks that workers perform as part of their jobs and the tasks that they perform which may be outside the scope of their specific job duties. For instance, ramp agents may be asked to deliver packages to people's homes. Rural Alaska does not have FedEx or UPS, but somehow the packages still have to reach the doorsteps. Customer service agents, who generally work indoors at ticket counters, may escort passengers to their planes on icy ramps and may assist with boarding and ensuring passengers are buckled in. Pilots often load their own cargo and fuel the airplanes. We include questions about injuries received on the job, regardless whether they filed workers' compensation claims. We also ask about the training workers received, not just for their occupation as described in their job description, but also about task-specific training. We are also asking questions which address specific issues relevant to advancing worker well-being through total worker health. These topic areas include questions about the organization of work, which includes the work environment, the culture, and fatigue and stress prevention. We will ask questions about work schedules and fatigue. We know that the summer season can be the most intense work time, but that is also when workers are busy in their off time, fishing, camping, hiking, and spending time with family. Many workers work rotational schedules, such as 2 weeks on and 2 weeks off, and may commute to and from their work sites. We are also asking about working while fatigued and reasons why someone would continue to work while they were fatigued. Analysis of responses to these questions will provide insight to work schedules, incidents of fatigue, and pressures to continue working while fatigued. The built environment supports ensure access to safe and clean work sites, which can be difficult to control when workers are at outstations or working outdoors. Questions about management's commitment to safety, health, and well-being, and the encouragement to report safety issues reflect the leadership in the organization and help to form the safety culture which is experienced by workers. Compensation and benefits includes workers' compensation benefits and access to health care. When asking workers about injuries and illnesses, we ask about the level of treatment received and where the injury, exposure, or illness was documented. We ask basic demographic questions and include questions on certifications and qualifications to help us understand the changing workforce in Alaska. Nationally, there are calls to address the imminent shortage of pilots and maintenance technicians, and anecdotally, we've heard that it's affecting Alaska's aviation workforce. But we have no research to document the effects of the shortage and any changes in experience level and qualifications of the workers in Alaska. Our goals of the survey project are to better describe the aviation industry in Alaska and to characterize the work environment for aviation workers, and not just pilots and managers. We want to better understand the implications and challenges to total worker health so that we can share this information with industry and work with the total worker health team and our industry partners to develop strategies and interventions to ensure robust safety cultures, enhanced worker protections, and ensure greater health opportunities for workers. This concludes my presentation. Thanks for your attention, and I will turn it over to Chia-Chia.
Hello. Thank you so much for this opportunity to share total worker health with our audience. We really enjoy the chance to give you a refresher on total work health, starting with the history, as Sara mentioned, and the current research. And now I will talk about opportunities for you to get involved. You now have a better understanding of total work health, having heard Sara and Mary, and we're ready to give you some resources so you can get involved right now. I'm going to move the slide to the next slide. As Sara mentioned, we fund 6 centers of excellence. They do all the activities that Niosh does: research, translation, and training activities. They have external advisory councils, which include labor representatives and employers, just like all Niosh projects do. And they fund pilot projects, so keep an eye on their website or join their email list if you're interested in that. I'll be going over some ways that they can help you through their resources and expertise. Another set of partners that we have is the affiliates. We know that we don't have the resources to fund every company and every organization, so we developed the affiliate program to recognize organizations that are committed to total worker health and to support these organizations in their efforts. The organizations that are eligible for affiliate status are basically nonprofit organizations and government entities. The affiliates are also a good resource for us when we need input or their perspective of practitioners. We go out to our affiliate network to ask them to share their experiences on the ground. The affiliates could also be universities conducting research or other types of organizations conducting research. We fund the 6 centers, but there certainly are plenty of other researchers out there who are interested in total worker health and who could really contribute to the field, and we wanted to include them in the affiliate program to recognize that. Plus, there are all the professional organizations that share total work health with their members, and we appreciate their efforts to train their members about total work health, to develop educational materials about total work health, and that is another reason that they are involved as affiliates. We could do joint presentations with our affiliates. For example, Dermot Hitchcock has been a leader in total work health, so we've collaborated and shared their findings. The Safe Workers' Compensation Organization in Oregon, they have many resources, and we've also partnered with them to share what Niosh has done and their efforts learned based on their engagement with their policyholders. Here is a big list of our affiliates. It is broken out by the first 3, Dermot Hitchcock, Mount Sinai, and NASA. And we have a few labor organizations because we always need labor at the table. There are many universities involved. Most are affiliates because of their research. Some are affiliates because they focus a little more on the translation activities. And even though they may be doing research on total work health, we also certainly would encourage organizations to apply total work health to their own workforce too. So it's not just in your research activities, but talking the talk. Just like at Niosh, we also have a Healthy as Niosh program for our own employees. We have a couple of workers' compensation programs, like I said, SAFE in Oregon and the Ohio Bureau of Workers' Compensation. And we have a few employers. They're mostly government agencies or healthcare institutes because those are the nonprofit organizations. And then we have some regional resources, such as the St. Louis Business Group on Health, the Valley Health Alliance. Those are nonprofit organizations or alliances of companies who are interested in total work health. And we have plenty of associations whose members are individual professionals, and also associations whose members are employer organizations. Actually, even though I sort of divided up in that way, most affiliates are involved with total work health in multiple ways. For example, the Center for Social Epidemiology, they do research, but they also conduct education activities. They currently have a healthy work campaign to share resources to reduce harmful work stressors and improve job quality and health. So it's hard to classify organizations as solely, research or translation or training activities. Similarly, the Labor Occupational Health Program, based out of the School of Public Health at the University of California, Berkeley, conduct research, build capacity of workers, and support development of protective policies to better working conditions. So there are many ways that organizations can be applying a total work health approach, whether it's through research or communication or reaching workers. The good news is that some of this expertise is available to you. Here are a few great examples available right now. The Oregon Healthy Workforce Center, one of the 6 centers of excellence, has developed a few toolkits which cover issues such as supervisor training, young workers, construction supervisors and employees, home care workers who often do not have sufficient training, ergonomic tools, or peer support. The center has developed the training based on research evidence, and the toolkits have been found to increase supervisor support or team effectiveness. And the center is now seeking employers to try out the toolkits. This is how we grow our evidence base, through partnerships like this. By participating, you get to attend their symposium, access all their resources, and have support during the program, and contribute to the research and be able to apply it and have their expertise at your own workplace. Similarly, the Center for Promotion of Health in the New England Workplace is seeking employers for an organizational readiness study. The purpose is to assess your organization's readiness for change. By participating in the brief online survey, you can receive a feedback report, and you may qualify for in-person consultation and technical assistance from the center. One other center that provides similar services of having an assessment and a meeting afterward, potentially providing technical assistance, is HealthLinks, based out of the Center for Health, Work, and Environment. That is available to not just employers in Colorado, but throughout the country too, so definitely look them up. But right now, specifically for Colorado employers, that center is seeking small organizations in Colorado for a multi-year research project to understand how small employers support the well-being of their workforce. This is really important because we know that 90% of businesses in the country have fewer than 20 employees, so small organizations are a high-risk area. This is specific to Colorado organizations. Some of the activities of the Centers of Excellence are focused regionally. They're almost like regional hubs. We appreciate the localized expertise of the center meeting the specific needs of their area. Here's another example of a local initiative. The Healthier Workforce Center of the Midwest has a call for proposals for research projects serving Iowa, Nebraska, Kansas, and Missouri. The deadline is in 10 days. But I wanted to include this so you'll know for future reference that each of the centers generally have pilot projects on research or translation activities. It's a great way to get started and have support for your initiative. Another way that partners can contribute to advanced knowledge is convening of meetings and conferences to share evidence and promising practices. Sarah mentioned a few of them, including the workshop with NIH. An outcome of that was another workshop, this time co-sponsored by the American Heart Association. This was just in the spring. It was a great way for Niosh to reach a new audience and it was a great way for the American Heart Association audience, many of whom are cardiologists, to gain new knowledge that they probably weren't used to seeing. That is in the past. What can you do coming up? Sure, there's something coming up. Coming up in November is the Work Stress and Health Conference, co-sponsored with the American Psychological Association and the Society for Occupational Health Psychology, a Niosh Total Work Health affiliate. Registration just opened this week, so that is late breaking news. It is too late to submit abstracts, but it is still a great way to go and learn about the latest research and promising practices. And finally, within Niosh, we need to have worker management at the table for all of activities, as I mentioned. We have the National Occupational Research Agenda, which establishes for the country goals for the next 10 years in occupational safety and health. NORA is divided up into 10 industry sectors, such as manufacturing, wholesale and retail trade, transportation, warehousing, and utilities. I'll let you look that up yourself. And 7 cross-sector programs, which include the Healthy Work Design and Well-Being cross-sector programs, under which Total Work Health falls, which Sarah had mentioned. The 10-year agendas are all developed with stakeholder input, published in the Federal Register, open for comments. The 17 programs also all have councils with Niosh and external leaders. All of this is ways to get involved with our activities. And plus, there's, of course, the extramural research that we fund that is separate from this. Another key activity by our partners, besides research, is capacity building. There are currently 3 graduate programs in Total Worker Health. Northern Kentucky University, a Total Worker Health affiliate, has a certificate. It's an 18-credit-hour certificate program based in the psychology department. The focus is occupational and industrial psychology, a key component of Total Worker Health. The Department of Environmental and Occupational Health at the Colorado School of Public Health and at the University of Colorado, they also have an online certificate program. It is 15 credit hours, and it is online. The goal is to prepare professionals with skills to apply research to practice, to design, implement, and lead science-based workplace interventions, and assume key leadership roles in public health, occupational safety and health, and in the business community. And the Western Kentucky University, a Total Work Health affiliate, Department of Public Health has a 18-credit-hour graduate certificate in workplace health promotion that enables students to blend health education, program planning, communication, and a basic understanding of workplace hazards. There are other programs being developed. University of North Carolina is one, so keep an eye out for other opportunities that are coming up. Now, those are long-term commitments. There are shorter-term commitments of learning about Total Work Health. One you're currently doing, the webinar series. There's 3 by Niosh. As we've talked about, we partner with our Workers' Compensation Center at Niosh, and the Working Hours Sleep and Fatigue program also has a webinar series. HealthLink, the program in Colorado, has a robust webinar series. The Oregon Center has just developed a podcast this year. That's exciting. And there are also longer-term ways to get involved, but not full commitments like an online program. There are single-day or multi-day events by the Harvard Center of Excellence, the Agricultural Safety and Health Center, the Midwest Center, and the Oregon Center all have in-person training that you could participate in, which is a great way to develop a network and really meet other people who are getting started in their Total Worker Health profession and in their workplace. Now, here are some on-demand resources at your fingertips for getting started on Total Worker Health, and I'll give you a couple of examples. In our quarterly newsletter and on our website, we have promising practices articles featuring examples from organizations that are taking steps to implement the Total Work Health approach. Dartmouth-Hitchcock, as I mentioned, an affiliate, developed supervisor training, trainings for team building, looked at opportunities for benefit design, and of course provided environmental support. A key approach that Dartmouth-Hitchcock took was that they aligned worker safety and health and well-being with their organizational culture. They even embedded it in their strategic and operational plan. Dartmouth Hitchcock has started to see positive outcomes from their commitment and work. Their workability program has sustained a very low start rate, the days away, restricted or transferred. Their workers' compensation temporary total disability has not grown, even though the number of people in the system has grown. The number of risks reported on their assessment has decreased, and the overall health plan has health plan costs has grown slower than average, and their workers' compensation experience modification has also decreased. That is an example of a promising practice that we have featured. Other promising practices that we have featured include our affiliates, the National Park Service, SAVE, the Workers' Compensation Center, and non-affiliates such as LL Bean, Dell, which has total workout in their sustainability initiative and actually includes total workout in their metrics, corporate reporting measures and reports, and the City of Bend Police Department, which has taken a leadership role in recognizing the psychological risks faced by law enforcement officers. You can see all these on our website. Other resources on our website for getting started are include links to our centers. As I mentioned, the CPH New program, the center in New England, has a very robust set of resources. They have short little video clips, about 1 or 2 minutes long, on how you could have meetings, facilitate meetings, so you can bring people together and get ideas started on how you could, what priorities you have and ideas for designing and implementing a program in total work health. Another set of resources is from the Harvard Center. They recently developed a assessment tool, a survey that you can take, and to supplement that, they have a robust guidance document on implementing a total worker health approach. The key is, of course, an integrated approach, as Sara said. Those are great resources from our centers, plus many more are available too. These are from our affiliates. The St. Louis Business Group on Health developed a very short, concise guidance on putting together the puzzle pieces for an integrated approach. I recommend that because it's short, easy to read, and very practitioner-oriented. And just like small business are our high-risk area, total work health isn't just for office workers. We really want to reach out to all the workers that are at high risk, such as agriculture. So AgriSafe, an affiliate, has a total farmer health program, which looks at psychosocial needs of farmers and all the hazards that they have to face, and are developing resources and a network for that. A new set of resources that just have posted in the last few weeks is by ASSP, the American Society for Safety Professionals. They recognize that their members are interested in total work health and are wanting to bring it to their organizations. So ASSP has created a website listing resources that safety professionals may be interested in to get started. Those are examples of resources by our partners. Niosh website, hopefully you've seen it. If you haven't seen it, I'll quickly go through some of the key aspects that I think that you'd be interested in. The Let's Get Started webpage has a few key areas. One is making a business case. It lists some data which could be useful to you as you're approaching your leadership or management to make a case for why your organization should implement total work health. If you want more resources, definitely reach out to us. We can always provide you with more data. We have a couple of short worksheets on ideas to get started, how you could first have that conversation with your colleagues who share the same goals as you of wanting to advance worker safety and health well-being. We have, as Sara mentioned, the fundamentals of total work health, which includes a couple of worksheets that you could use. It's very applied as a short, simple, I think it's about 17 pages, way you could use this as you're having your meeting with your colleagues to bring total work health to your workplace. And coming up, as Sara said, we are developing with RAND a framework for total work health, for work well-being. We have the framework. It's a long definition for well-being, but we are now developing a survey based on the framework the survey would be used, it would be administered to employees, or people could take the survey themselves to assess the well-being of the individual workers, and we think researchers, policymakers, employers could use the data from the survey to understand the well-being of their workforce. Look for that coming up in the next, hopefully by the end of the year. That'll be a tool that we will make available on our website, which we think will be really innovative because there's nothing out there right now. And as I mentioned, there's the Total Work Health webinar, which you're participating in. Thank you very much. Be sure to sign up for the next webinar. If you think we talked a little too fast and there's something you want to go back and listen to, all of our webinars are archived online. So you can listen to it at your leisure. And I'll wrap up by saying, definitely reach out to us if you have any questions, if you need anything else, and thank you so much for all that you do. We are all working toward the same goal, which is for people to leave work. Animation isn't working. To leave work healthier, happier, with more well-being than they started work. This is a vision that we have in Total Work Health for work to be a recognized means of achieving well-being. So we don't want work to just not harm you. We want you to actually have more well-being because of the great work that you're doing. And why is this important? Because, as Stephen Hawking said, we think work is very important to our lives. It contributes to having meaning and purpose, and we want people to benefit from their work. Thank you so much for all that you do for workers and workers' well-being, and we're happy to take any questions that you may have.
Thank you, Chia-Chia, and thank you, a big thank you to Sara, Mary, and Chia-Chia for those enlightening presentations. Very thorough, very informative. I want to reiterate what Chia-Chia said, which is that you will have access to our webinar. This and past and future webinars are available. They are archived, and they're a wonderful resource for learning more about total worker health and, of course, how we can protect and promote worker safety, health, and well-being within the workplace. I've got some questions to pose to our speakers, and if you haven't done it yet and you have a question, make sure you go ahead and type that in on the Q&A portion of your web page, and I will sort through the questions and present them to our speakers. I'm going to start with a very broad question for everyone on the idea of organization of work. And our question is that we like the idea of organization of work, but at the same time, what if the organization of work has to do with factors only within the employer's control, such as workload demands and work-life balance? So I'm not sure what the question meant about how that was framed, but how do we approach those topics of work organization that are under the control of the employer? I think that might be what the question was getting at. From a total worker health perspective, how do we motivate change for those factors that are under the employer's control?
So this is Sara. Thank you, Jeannie, and thank you to the person who asked the question. It's an important question. So certainly there is a lot that is under the employer's control. Fortunately, there are a lot of opportunities, small tweaks even, that can make a huge difference to employees. So if you follow international outcomes, this will not come as a surprise to you that the U.S. ranks number 30 out of 38 countries for work-life balance, right? So we have a ways to go. Work-life balance is a concern we have found for all workers, be it at different degrees, often depending on stage of life and career. Now, when we look at some of the top work-life balance issues, just to orient us, let me see if I can remember my statistics here. I think about 30% indicate that their chief work-life balance issue is due to issue with coworkers, ineffectiveness, inefficiency. Equally, about 30% credit long commutes. Nearly 40% say it's because they're constantly working beyond standard business hours, Nearly, I believe, 40% as well indicated due to inflexible work hours, time off, scheduling issues. Nearly 60% note technology is an issue because supervisors expect responses at any hour, and about 60%, I believe, as well, determine it to be chiefly due to a bad or unhealthy supervisor. So again, just as the case with issues such as stress and unhealthy leadership, there are a number of worker consequences to this imbalance or conflict in work life that employers ought to take note of. So again, as we think about how to make the case for employers, if altruism aside, there is a case to be made. We see with poor work-life balance, we see poor morale, productivity, high turnover, higher risk of stress, feelings of burnt out among workers, fatigue, higher cortisol levels, coronary heart disease, accidents, injuries, and so on. So then looking at what employers can do then from a total worker health perspective around work-life balance, leadership is a huge one. Leadership can tailor responsibilities so employees have adequate time to complete work tasks. They can train managers to better identify and address stress, which is highly related to work-life balance or imbalance. They can monitor performance indicators such as absenteeism, presenteeism, worker satisfaction, and then job flexibility. Now, leadership is the number one reason why employees leave a job, leave an organization. Job flexibility is the number two concern. Well, they can do something about this. They can modify work using alternative work schedules, telework, flexi time, avoiding, of course, all or none policies or blanket approaches, and providing reasonable accommodations. Support is a huge one. They can encourage and allow non-work and well-being activities during work hours. And then finally, I would say communication. They can educate employees of the risks associated with long work hours because it's not necessarily known by all. And then embolden employees to speak up if they experience work-life conflict. So not fully knowing the question's intent, again, in total worker health, it's about first and foremost at the organizational, at the employer level. And if employers feel that there's nothing that can be done, it is factually evidence-based and correct. And there's so much that can be done, some of which is pretty straightforward, as you saw, very to low or little cost, and we have many resources to help with that.
Thanks. This is Chia-Chia. I wanted to add on to that. I appreciate the question. I just want to be extra clear. Sara answered it very well. You're extra clear when you asked about, organization of work. Organization of work is something that we see as being under employer control. That is one of the things that we're lumping in the category of an employer initiative. So just want to be clear that in addition to things like workload demand, work-life balance, which are under employer control, we also see organization of work as something that is within employer control. And this is important, as Sara said. One key challenge is, of course, that we know some of the people who are interested in total work health are maybe, consultants or professionals who are providing advice to leadership. So you may not have the management power to make the changes yourself, but we think that as consultants and advisors, you really are able to provide the evidence for this to make the case to leadership, because these are the people who are able to access leaders versus the workers themselves may not have that direct access to the C-suite to make these arguments. Thank you so much.
Thank you both, Sara and Chia-Chia, for that, for those detailed answers. And Sara really covered the gamut in terms of things that employers can do that are, little small changes, as she said, that are inexpensive, that can really have a great impact on a broad range of the workers. I want to note, just as a reminder for everyone, that if you look at the bottom right-hand corner of your screen, you'll see a box that says downloads. The slide deck is available there for download, and if you come back to the presentation at a later date, you'll be able to access the notes. And so if you're furiously trying to write down the recommendations of our speakers today, you can come back and listen again, and also view the closed captioning if you so wish. Our next question is for Mary. What percentage of aviation workers in Alaska are covered by workers' compensation? Do most workers work for wages, or do they work for others, work for someone else for wages, or is there a lot of owner-operators? Are there owner-operators in Alaska, aviation workers?
Thank you for that question. That is a great question. And my short answer is we don't know what the percentage of aviation workers that are covered by workers' compensation. We have a vast disparity in sizes of organizations. Our largest in-state aviation company employs close to 1,000 people, and we have many operations that only employ one person. So those would be what we call our single pilot operators, and they work for themselves, but by regulation we know that they have one pilot, but we don't know how many other employees they may have. So they may have a mechanic or someone to help in the office who schedules flights and helps with the accounting, but we don't know how many employees they might have. So this denominator information is something that has been lacking. We're aware of this, and it is one of the areas that we address on our surveys. So we have a separate survey questionnaire just for single pilot operators, and we ask them about the number of employees and what their employees do, and we also ask the managers of the non-single pilot operators how many employees they have and what types of occupations they are. So every employer who has employees working in Alaska must purchase workers' compensation insurance or be approved as a self-insurer, but how many of those are employed in Alaskan aviation? I'm sorry, I can't say that right now. Hopefully after our surveys have been collected and analyzed, I'll have a better answer.
Thank you, Mary. Next question, Chia-Chia. Can the affiliates can the nonprofit affiliates be located in Canada?
Yes, actually, we have recently opened up the affiliate program to organizations outside of the United States. We do have limited resources, so I think we're going to be extremely careful about that. But yes, that is open now to non-U.S. entities. And I want to go ahead and make an apology for one thing I omitted. We do now have a new affiliate, the University of Texas Health Sciences in Houston. They have an approved PhD program in total work health and is admitting its first trainees this fall. That information is not on our website yet, but it will be. Thank you.
Excellent. Chia-Chia or Sara, assuming that both the Oregon and New England programs, the question is basically, are the Oregon and New England programs seeking participants for toolkits? Are they accepting participants in those programs from outside of the Oregon and New England areas?
Yes, for both.
Okay. All right. Let's see. Also for Sara or Chia-Chia, do you have any examples of successful total worker health programs in large university settings designed for the university employees? That is, not with the university conducting research with community employers, but rather a program that is designed to benefit the university employees.
That is a great question. Most of our universities are doing research, as I said. Some of them do also include initiatives for their own employees. That is definitely something we encourage. And there are examples from different universities. I know the University at Texas at San Antonio, for example, they provide a few hours per semester for employees to participate in wellness programs so that they don't have to take leave for that. So there are some examples like that, yes.
Okay, great. Thank you. Let's see. Okay, Sara, Chia-Chia, have we done any work with NWI or WALCOA, who are also doing similar work?
Yeah, the National Wellness Institute and Well Co-op, we have connected with them, and I think we just had a conversation with one or two of them 1 or 2 months ago. So yes, we are continuing to explore opportunities to share resources with them too. And for them to share our resources and for us to share our resources. And we've done presentations previously at the National Wellness Institute, and we've also collaborated with Well Co-op. Thank you.
A note from Casey from our program that UCLA is also spearheading a statewide program to improve work and well-being for students and workers of UCLA. So there's another example of a university that is moving toward, promoting total worker health approach.
Yes, thank you. Thank you, Casey. That's a great initiative. They've been planning this for over a year. They're having regular meetings. It's very robust. They brought together all the different departments and disciplines across their different campuses. It's very impressive.
Okay. We have another question. Are there any survey tools that are available now that can help employers assess worker well-being?
There are surveys that assess sort of health. There's the the National Health Interview Survey that Niosh funds supplements to, where we look at worker safety and health issues. The Niosh Work Life program has on our website, and this is accessible through the Niosh Total Work Health website, a work life organization of work survey, which looks at working conditions. That's very good. Many people use other tools such as HERO and CDC surveys that look at programs available at and organizations. But all of those are sort of focused on different aspects. It could be looking at health, it could be looking at safety, it could be looking at organization of work. And those are on our website. But of course, reach out if you need something specific or can't find it.
And just to add to what Chia-Chia said, one of the surveys that she mentioned is actually able to that Niosh administers and is available for public use, is the Quality of Work Life Survey, and that survey is available on our website and can be used to administer within work settings and address work organization issues, as well as some health and safety outcomes, but not work or well-being broadly, but some safety and health issues. Another question, is there data you can discuss that has health effects, including psychological health, broken out by job title, supervisor, manager, production employee, etc.? The pressures are very different within these jobs, typically for each category, and they're curious if we have any articles published looking specifically at these differences. And again, they note that the pressures within the jobs are different, as well as access to resources outside of work. So are we aware of a resource or an article that breaks down health effects by job?
This is Sarah. There definitely are such articles. I guess with just a few minutes left, I would suggest that the person who asked the question reaches out, and then we can direct she or he to those resources, those articles. But they do exist.
All right. We have about 3 minutes left, so I'm going to we've got a couple other questions to see. Website, what website is your go-to for reliable workplace mental health stats? Does anyone have one quickly?
Well, I guess we can't. As a government agency, we would have to recommend SAMHSA, and also NIH has a mental health institute. Both of those would be good resources.
Okay, thank you. Are there any programs for government employees applying total worker health?
Yeah, I'm sorry, I'm going to go back to the mental health thing. I forgot. Of course, the American Psychological Association has done surveys on workplace health, and they've got great data on stress in the workplace. So the American Psychological Association would be a fantastic resource for data on workplace mental health stats. The government employees applying total work health, yes, there is a federal consortium that for workplace health professionals in the government. That's a consortium where they meet and have calls regularly. It's not focused on total work health, but they certainly know about total work health. We presented to them, and a few federal agencies are total work health affiliates. So if there's something specific you're looking for, please do reach out.
And of course, Niosh has Healthiest Niosh.
Right. Sara, we've got 1 minute left. I've got two very quick, hopefully maybe quick questions for you. One is we had an inquiry about the importance of vaccines and whether or not vaccine hesitancy kind of rises to the surface as something that is being considered by Total Worker Health. And as you answer that briefly, maybe you could also talk just very briefly about our Future of Work program before we wrap up in a minute.
So Total Worker Health encompasses of everything, certainly, be it immunization or other things. If you look at I think the person who was asking the question was referring to our issues graphic. So that issues graphic, contains a certain set, but a limited set. So it's not an exhaustive set of issues that are important or applicable with the Total Worker Health approach. If you looked under compensation and benefits, for instance, such immunizations could fall under chronic disease prevention and disease management or access to confidential quality healthcare services. So we don't single out something. I will say this, though, or it could be under policy issues. For instance, I worked at a place where, because of healthcare considerations, it was mandatory for employees to be immunized. That said, I do want to be sure to say that Total Worker Health is examining how the work organization and work itself can influence worker safety, health, and well-being. And we're very much, it's about embracing voluntary and participatory interventions, programs that protect workers' rights and privacy, that don't blame the worker, that don't penalize the worker. So when we talk about immunization, we have to be careful from a Total Worker Health approach that we're not falling in the worker level individual responsibility onus, but rather from an work organization standpoint. And quickly for the Future of Work, so this is an initiative that is brand new last month, so more to come. And again, our website should go live soon, so I encourage you to look for that and come back regularly. Our overarching goals, as I mentioned, are to compile current Future of Work studies, really get a sense of what's out there, future current ones, promote Future of Work research, particularly in the areas of new industries, new technologies, new organizational design, job arrangements, risk profiles, ways to control new risks, as well as connecting all of this. Some of the goals we might tackle really are identifying and examining the new economic pressures and incentives out there. Forms of new work that workers will be doing is very important, especially in the Industry 4.0 related. Impacts on aging, gender, race, ethnicity, and other demographics. Job displacement from automation is a big one. And then developing better taxonomy around many of these issues that are still, they're new, they're the future. Determining and promoting new research methods, offering practical, tangible solutions to safeguard workers who are entering the future of workforce, and then very much surveilling, evaluating, and adjusting as we need to do so, and then work as well in the area, some of you might be aware of this if you know about future work, exploring the feasibility of futures, foresight, and horizon scanning. That's work that's already ongoing at Niosh. So again, lots of possibilities. We're brand new, lots of work already at Niosh, but more to come. And so please, I encourage you to look out for that website. If you're a Total Worker Health newsletter subscriber, you'll definitely learn of it that way or through our other mediums. And feel free, as always, to reach out if you would like more one-on-one time to discuss these issues.
Thank you, Sara. We're at the end of our time today, but I want to thank each and every one of you for participating and viewing the webinar today, and for your active engagement, for your questions, for your continued support of our Total Worker Health program. And I will remind you that the slides are available for download and that you can access archived webinars on our website. A final thank you to Sara, Mary, and Chia-Chia for their speaking today, for sharing their knowledge with us, to Sarah Mitchell for arranging and coordinating this webinar, and to the Total Worker Health Program for all of the work that is done to help spread this important information that can help advance safety, health, and well-being of our workforce. With that, we'll close for today with a final thank you.